Diagnosis. What happens to the doctor? To find out what type of headache it is, the doctor will take a detailed medical history. Among other things, he asks about the frequency, type and duration of the pain, the area of the head in which it occurs and other symptoms that occur together with or before the headache, such as visual disturbances, watery or red eyes, but also nausea or vomit. It is also interesting to see if there are other people in the family who have headaches and what makes the pain easier or worse. After the interview, the doctor examines the patient. In doing so, he accurately assesses the functions of the nervous system. This is important because abnormalities in the examination are a possible warning sign of a symptomatic and thus potentially dangerous headache. On the other hand, if the medical history is typical and the physical examination is normal, the doctor can make the diagnosis without the need for further examination procedures. If, on the other hand, a known headache intensifies, the symptoms change or the doctor cannot clearly assign the symptoms to a group of primary headaches, especially if they occur for the first time, it is important to ensure that there is no other illness behind it. The same applies if, in addition to the headache, certain symptoms such as visual disturbances, speech disturbances, paralysis, seizures or numbness occur. In order to get to the bottom of the cause, in most cases the brain is first examined with an imaging method. Usually, this is magnetic resonance imaging, MRI, which is the best way to rule out a dangerous cause. Alternatively, in acute cases with headaches that have only recently started, computed tomography of the skull, CT, can be useful, for example to rule out a fresh cerebral hemorrhage. In addition to these imaging examinations, the doctor can choose from a wide range of diagnostic procedures that can help him to confirm his suspected diagnosis and/or rule out serious illnesses. When it comes to whether a seizure disorder, epilepsy, is present, a recording of the brainwaves, EEG, can be clarifying. For example, if meningitis is suspected, however, it is necessary to obtain nerve fluid, liquor, for an examination in the laboratory. Sometimes it helps to determine certain blood values, for example, the inflammation parameters, if the doctor suspects that there may be inflammation of the temporal artery. X-ray or ultrasound examinations can also be useful, for example if a sinus infection is suspected or a tear in a blood vessel in the neck area is a possible cause of the headache.